Okay, so now this is the larger heart model. And again, you can see we have the pulmonary trunk coming off here, forming the pulmonary artery. We have the aorta coming off here. So I'm going to move those out of the way. You'll see here that we now have this structure coming down here, forming the superior vena cava. This structure coming this way and this structure coming down this way is actually the brachiocephalic. So this is the brachiocephalic vein coming from the left, and this is the brachiocephalic vein coming from the right. Now, the veins are formed when the subclavian veins merge with the jugular veins. So here you have the subclavian vein right here coming in, and as it comes in, it merges with these two jugulars. This jugular is the external jugular. This jugular is the internal jugular. When the two jugulars merge with the subclavian, it then turns into the brachiocephalic. And again, you can see that on this side as well. Here's the subclavian, here's the external jugular, here's the internal jugular, and again, it merges together to form the brachiocephalic. The two brachiocephalic will then merge together to form the superior vena cava. Now, this branch that's coming down here is actually coming from the thyroid gland. So this is actually the inferior thyroid vein, and that's what that is right there. Here you can actually see that there are three branches coming off of the aorta, like I had mentioned before. The first branch is the brachiocephalic artery. There's only one brachiocephalic artery, whereas there are two brachiocephalic veins. So here we have the brachiocephalic artery, and as the brachiocephalic artery goes up, it forms the right common carotid and the right subclavian. And that's what that is there. The other two branches that are coming off form the left common carotid and the left subclavian. If we turn this towards the back, you'll see that there is another blood vessel coming in towards the superior vena cava. This is the azygous vein. So that's what that is.
How do you spell that?
Azygous?
Yeah.
A-Z-Y-G-O-U-S.
Okay.
Here you can see the trachea coming down and the esophagus coming down. And you can see how the esophagus is actually coming down and going past the heart, which is why when people have a burning sensation in the esophagus, they say it's heartburn, but it's not. It's not the heart that's burning. It's actually the esophagus that's actually burning or creating that sensation. You can see here's the primary bronchus coming off, heading towards the lungs. You can see that the pulmonary veins here are coming in and heading towards the atrium. Note that the pulmonary veins are red, whereas the pulmonary artery, which is here, and it would be here, is actually blue. And that is because the pulmonary arteries are going to be carrying deoxygenated blood, whereas the pulmonary veins are going to be carrying oxygenated blood. And this is only reversed when dealing with the pulmonary system. Otherwise, arteries are red and veins are blue. Okay. Now, this of course is the descending aorta, and you can see that these branches coming off of here are actually going to be going to the ribs. So these are going to be the intercostal arteries coming off of that. Let's see here. Again, we have the coronary sinus here. We have, again, the middle cardiac vein and the posterior interventricular artery. We have the coronary artery here and the circumflex artery coming this way. We have the great cardiac vein coming over this way, which will come this way. And then we have the anterior interventricular artery here and the great cardiac vein here. Back up here. You'll see the coronary artery going across like that. So that's that right there. I'm going to move these out of the way a little bit. Now, you'll see that there are these muscles here that are lining the atrium. These are what are called pectinate muscles. These are what help the artery to contract. So here would be the tricuspid. This would be the bicuspid. You can again see these cords of tendons here. That would be the chordae tendineae, which then lead to these muscles here, which would be the papillary muscles, right there. Then we have, again, the interventricular septum. We have the myocardium. We have the epicardium, which is this thin white material here, also known as the visceral pericardium. And let's see here. It's hard to see the fossa, but deep in there, I don't know if you can see that right there. You see that?
Mm-hmm.
That is actually the fossa ovalis, right there, which originally was the foramen ovale. You can see here the pulmonary semilunar valve right there, and then over here is the aortic semilunar valve right there. And that's